Hi, good to see you.
I'm really glad to see both of you. So today is part 2 of 3 of our Cannabis Chronicles, yeah?
Cannabis series. I'm not sure what we're going to call it, but it's a chronicle. We're doing, this is the second of a 3-part series we're going to do, and I'm going to go into the science and some of the medical research on it. And then in the third segment, we're going to interview local people, patients, and dispensary owners. So, ready to go?
Let's do it.
Let's do it. Okay, here we go. From the beginning. Here we go. Oh, I love this little graphic. It's a science cat. So, cannabis as medicine. Did you know that there are annual science conferences in Portland and all around the world in many places in the United States? They have a 4-day conference where they bring in researchers from all over the world, and yes, including the United States. This is Derya Meyer from Israel, who's been doing some of the seminal research on cancer treatment and cannabis, and he works for the Technion Institute, Israeli Institute of Technology. And by way of review, we ended last time by talking about what the National Academy of Sciences is saying and analyzing more than 10,700 studies on cannabis and its conclusive evidence of medical benefits for chronic pain, nausea, for cancer chemotherapy, multiple sclerosis, muscle spasms, neuropathic pain, epileptic seizure control, and then anecdotal evidence, which are case reports reported by patients and also their primary care of docs about how these people are using this. For example, this one here, the NFL players are asking for it to be used so they can use it for the concussions and to prevent chronic, the CTE syndrome and chronic encephalopathy that you get from getting hit in the head too hard. I'll go into that in a little bit. So there's the question, I think, that you asked last time, Derya, or maybe it was just, you asked me as a sidebar sometime, but the drug scheduling guide for the United States lists Schedule 1 cannabis, Schedule 2, and 3 and 4. This is the way that the DEA developed it in the 1970s under Reagan. They developed the scheduling system. So Schedule 1 is no medical qualities whatsoever, high abuse and dependence capacity. And they list heroin, LSD, marijuana, ecstasy, and peyote under that. Schedule 2 is high potential for abuse, some medical qualities, Vicodin, you take it for dental stuff. Cocaine, I had cocaine shoved up my nose when I had a nasal surgery. They did a local with cocaine still, so that was interesting. Meth, they have meth there as some medical qualities. Oxycontin, of course, that's been in the news lately, and Adderall is for attention deficit disorder, and it's kind of like a pharmaceutical speed. Schedule 3 drugs, Tylenol with codeine, everybody's heard about that. Ketamine is something that's been out there recently for depression. Steroids, dextromethorphan, the president's on and people who get COVID and have lung problems are on steroids, and on testosterone for people with low testosterone. And so then you go on to these other Schedule 4 and Schedule 4 and Schedule 5, and Schedule 4 and 5 is where you can start to do some. You get more latitude in terms of doing studies and testing. But when cannabis is up here, it's very hard to get approval for drug testing protocol for research protocols.
Is it still there, David?
Yes. Huh?
Oh.
Hello? What?
It's still there?
I'm sorry, what?
Is cannabis still considered a Schedule?
Schedule 1, yeah, it is, right. Still considered a Schedule 1 drug, and that's why physicians can't prescribe it, because it's in, the DEA will go after their license. But in states, what's happening is the authorization is being Some states get around that by having a pharmacist and a physician do that. In the state of Washington, it's mostly naturopathic physicians that are being authorized to prescribe it, although you do see some cancer oncologists who will sign the authorization. I had a friend who was at a really severe sarcoma. He died after 2 years of treatment, but his Kaiser physician authorized him to use it for to increase his appetite and for nausea. So, and I'll get into that in a minute in terms of cancer and some of the studies on that. So cannabis and chronic pain, it's a biggie. Intermittent pain, people have all sorts of pain, arthritis, all sorts of intermittent pain from injuries, sports figures, or people who work out sometimes have injuries, right? So this was a small study, but 118 patients with chronic pain. They used 64%. They had a 64% reduction in the use of opiates and a 45% increase in the quality of life. And what you see in studies in states where they've authorized medical cannabis is a significant reduction in the use of opiates, anxiety drugs, and antidepressants. So you can see that might get the attention of the pharmaceutical companies with that happening.
Hit them where their profit level is. You know, David, there was one slide back from that. Did you want to talk about that? That one. Did you want to talk about that a little bit?
Well, yeah, sure. We shouldn't slip over that. Sorry, thank you. So this is a comparative, it lists the risk of dependency and side effects of very common use substances. So you got dependence, withdrawal, tolerance, reinforcement, intoxication as the categories, and the more serious are the highest numbers. So you see here nicotine, which is one of the most addictive substances that we have, and then it has a really high withdrawal and tolerance profile as well. Heroin is up there as well, and then cocaine next. Alcohol.
What does reinforcement mean?
Reinforcement means that you have the need to keep taking it to reinforce the good feeling. And it's just sort of with a tolerance. It goes along with tolerance. Now, I want to just put an asterisk here. Cannabis isn't a panacea, but when you compare it to, as you should do with all medication that you're taking, is look at the risk-benefit ratio. Are the risks higher or lower than other medications? And when one of the things I found out by researching pharmaceutical drugs is they very rarely do that as compared to other drugs. They'll just do it independently and say this is better than placebo. And as we know, much of the time, pharmaceutical companies hide the deleterious or adverse reactions, and they have budgets in the billions of dollars for lawsuits for adverse reactions or people having debilitating conditions. But so alcohol is pretty well known, cocaine and heroin. It's pretty surprising to see that the cannabis is only 9% as compared with as compared with 15% with alcohol, 17% with cocaine, 23% with heroin, and 32% with tobacco. I remember when I was in the Navy, I was stationed at local naval hospital, and everybody was smoking Marlboros, right? So I picked it up and smoked for a year, and had to go cold turkey a couple times, but finally got off of nicotine. And boy, did I feel better after that. So, does that make sense, Derya? You were asking?
Yeah. Oh, absolutely. Yeah.
Okay.
Was it hard, by the way, to get off of the cigarettes?
Yeah, it was. They didn't have nicotine gum or patches back then, but a lot of people are using nicotine gum patches and behavioral therapy now to get off of nicotine. it mimics the one of the chemicals in the brain called acetylcholine, and that's one of the reasons it's so addictive. Nicotine is so addictive. So one of the wonderful things about cannabis is it can be a replacement for a lot of drugs of polypharmacy, or reduce the dependence on, or reduce the number or the quantity of those drugs you have to take. And here was a study where 64% reduction in opioid use and 45% in quality of life. There's a small study, but when you look at all of the medical cannabis states, of which there are over 32 right now, you see that consistently across those states that have implemented medical cannabis dispensaries, that they have found that the use of opiates, anti-anxiety medications, and antidepressants have decreased as people have replaced that with cannabis. So, and we all know about the opiate epidemic in the United States and how it was promoted by the pharmaceutical companies, and now we're trying to rescue the country from that Pandora's box that was opened up by the for-profit companies. So we have 33 states, and then 11 states that are fully recreational, 33 medical states, including Washington. Each state has different qualifying conditions too, which actually makes it very confusing. So even though you may not be on this, you may not have a diagnosis that's identified on this list, sometimes there are diseases, this 1, 2, 3, 4, 5, fifth bullet diseases, including anorexia, which result in nausea, vomiting, wasting, appetite loss, cramping, seizures, muscle spasms, or spasticity. So there's a lot of chronic conditions that fall underneath that issue. Traumatic brain injury, post-traumatic stress disorder, those are pretty common. And we'll talk in a minute about neuroprotective factor of cannabis. Hepatitis C, that's pretty interesting. Crohn's disease, which is a bowel disease. Glaucoma, people have known about that for a long time. Intractable pain and cancer. Those are all things that are authorized under the Washington qualifying conditions.
It's a huge spectrum.
It is. It is. So for example, you might notice that Parkinson isn't on this, but under seizures, muscle spasm, and spasticity, and appetite issues, you could be prescribed for Parkinson's. Now, in other states, they actually have Parkinson's on their list as an identifying issue, and some have autism on there for kids who have autism. So the main thing we want to realize here, or just the larger context we're talking about, is the reason this works is because we have an internal endocannabinoid system that's one of the homeostatic regulating stress management systems of the body. We've known for years about other stress management systems like the adrenocortical system that produces hormones from your adrenal glands when you're under stress. And then we also know that there are other systems that help us downregulate that are called from the parasympathetic system. And those are, we've talked about the runner's high and used words like endorphins and enkephalins to describe those kind of neurotransmitters that help us downregulate and relax. Well, it turns out, we discovered in 1998, that there is an endocannabinoid system that does the same thing, and that we can have, and that it produces, our endocannabinoid system produces a neurotransmitter called anandamide. And that is actually from the Sanskrit, anandamide, which means the bliss hormone. This is a good way to describe it. But here's and it hits specific receptors in the body that that help downregulate the stress mechanism, and then prevent dysregulation that can cause chronic disease or pull back people from the brink of chronic disease and actually heal the body in inflammatory processes. And as many of you probably have heard out there in YouTube land or wherever we're broadcasting from, is that anti-inflammatory inflammation is one of the major causes of disease. We've discovered, especially chronic disease. So anything you can do to reduce inflammation is going to benefit you health-wise. So it's a homeostatic modulation system, a stress management system, and it hits these different receptors. The CB1 receptors are mostly in the brain, and CB2 receptors are in what we call the peripheral nervous system, the nervous system outside of the brain, all the nerves running through the body that energize the gut, the kidneys, the pancreas, adipose tissue, skin, immune system. So you can also, the CB1 receptors, CB1 and CB2 receptors are both activated at the same time if you use the right combination of cannabis therapeutics. And now we're thinking that like a lot of stress diseases, our systems from chronic stress and inflammatory processes lead to an endocannabinoid deficiency where our brain does not produce, our bodies do not produce enough of the downregulating endocannabinoids or the neurotransmitter anandamide. So anandamide is released in response to stress, but it degrades very quickly, and you need to keep reproducing it. And we used to think that calmness was produced by what we used to call the internal opiates, or endorphins and enkephalins that were called the endogenous opiates. But now we discover there's actually the cannabinoid system that produces relaxation and downregulates the body. It's one of the major relaxation systems in the body. And there's references down there in red. Here is Sue Sisley. She's associated with the Scottsdale Research Institute. I got to meet her and talk with her and see her presentation last year at the Cannabis Science Conference in Portland. I've attended the last 4 years of those, and it's just amazing to hear these people talking about it, and also about the struggles they have in doing the research and getting it recognized. And as Sanjay Gupta said in the previous slide, in the first session, it's clearly medically proven, and it's unethical not to consider it as a medical intervention and to research it. So currently the US government, this is one of the things Sue has been talking about and advocating about. The US government holds a monopoly on all cannabis grown for research purposes in the United States, and it's cultivated only at the University of Mississippi. And to conduct any kind of weed research, scientists must apply to the DEA, and then the weed can only come from this one farm. And unfortunately, the government weed is complete shit. This is Sue Sisley talking about it. And it resembles hemp more than it does marijuana or cannabis, or the things you find in a dispensary, which doesn't work for research regarding THC or even CBD. In fact, it's so degraded, it's made up of stems and seeds and leaves and some flower. But when you go into dispensaries, what you get is all of the product made from the most highly concentrated, the most therapeutic, which is the flower. So you can see here that the research is being hampered by, for whatever reason, the DEA and the federal government deciding that they are all going to issue really low quality medication for research, or cannabis for research as medicine.
Really begs the question, why?
Gee, I don't think you have to think too hard about what, look back to that slide on the impacts on the use of opiates and anti-anxiety agents, and
the pharmaceuticals pocket?
the pharmaceutical companies were the highest anti-cannabis contributors, and they do that in all the states. They go in, that and the Catholic Church, interestingly enough, are the two highest contributors to anti-marijuana legislation in the states. So CBD is all in the news. That's cannabidiol. It's one of the 100 or 144 different compounds in cannabis. So we're just scratching the surface here in terms of understanding all the medical benefits of it. People are talking primarily about CBD and THC, and cannabidiol is relatively safe when taken by mouth or sprayed underneath the tongue. And it can even be taken in doses up to 300 milligrams a day. And for people who have Crohn's disease and irritable bowel disease, that's sometimes what they need to take. And then as this condition settles down, then they can be on a maintenance dose, so under 100 milligrams a day. But you start small, you start small and you go up and you gradually increase the dose. A lot of people, so the guideline for any medication is to start low and go slow. I mentioned IBS, or bowel syndrome. So the results of a lot of studies correlate and expand the findings that suggesting the CBD is a potent compound that is able to modulate experimental gut inflammation in mice and human tissue samples. So these are what you call the clinical trials, but they're not phase 3 human studies. But there are a lot of case studies that are coming out from people that are going to naturopaths and physicians and getting treatment with CBD and one-to-one CBD and THC tinctures, and finding that it helps heal their gut and that they can get off a lot of polypharmacy or even avoid bowel resection surgery. So it's pretty dramatic, the impact that it has on the inflammatory.
Getting pieces of their intestines cut out?
Yeah, avoiding that. So imagine that. You get the choice of, well, we could put you on this course of take a CBD and THC. We'll titrate it up so you won't have any too many side effects from it. Or the choices are, we could cut out your bowel and give you a colostomy bag. Which would you prefer? I would go for door number 1. So cannabis and neuroprotection now, this is a huge thing. And what they found was that people who started using cannabis in the 60s and continued to use it, they noticed that they didn't have as many cases of Alzheimer's or dementia. They said, that's interesting. So Gary Wenk from Ohio State University, he's a neuropsychologist there. He's been doing a lot of studies on this. And they found out that, again, the incredible abundance of anandamide receptors and the neurotransmitters in regulating the brain function respond to taking cannabis, because it bumps up the response of the internal endocannabinoid system. Everybody has a different endocannabinoid tone, a different cannabis system, depending on all the factors that we know about, what their mother's pregnancy was like, the epigenetic factors, the stress factors in the first 5 years of life that sets them up for, and also for the first 18 years, 24 years of life, that sets them up for chronic disease. So through no fault of our own, we're eating crappy food or have stress in our families growing up, we can develop chronic stress syndromes that can lead us to chronic inflammatory conditions. And one of those is Alzheimer's and dementia. So later in life, what Wenk is suggesting, and many other neurologists, is that cannabis, daily doses of cannabis, small doses of THC under 1%, with judicious amounts of CBD, might protect the brain, and it certainly seems to rescue people from even traumatic brain injury and slow down the damaging effect of traumatic brain injury, like NFL players or like me. I'm at risk for dementia because I had 2 traumatic brain injuries before I was 9 years old. I was hit by 2 cars. One when I was 3 years old and when I was 9. I had bad spatial recognition, I think. I always thought I could get there before the car, I could cross the street before the car got there. Anyway, so I take daily doses of CBD for that reason, and also for the anti-inflammatory. So the THC has 20 times the anti-inflammatory potency of aspirin and twice that of hydrocortisone. And both of those have pretty high risk physical profiles. It's well known that a lot of these non-steroidal anti-inflammatories and aspirins cause gut bleeds, GI bleeds in your gut.
And aren't they bad for your liver too? I mean,
It affects your liver as well and your kidney function. The non-steroidal anti-inflammatories is responsible for a lot of kidney disease, and this COX inhibitor mechanism is also the reason that the Vioxx was withdrawn and then reintroduced to with a black box label because it causes heart attacks.
wow.
So again, the choice is, well, do you want to take something that causes a heart attack, or you have to have really close medical monitoring in order to take the drug, or do you want to have something that you can gradually increase the doses, get one that works for you and that will have 20 times the anti-inflammatory effect.
I have to say there's something so deeply whimsical about this, that so much that is good is taken out of the hands of the people who really need it. And we've gotten into this surreal upside down reality where you should have to put up with these horrible side effects that are often in the commercials said super fast and in little teeny tiny print. And it's such a false choice from everything you're saying.
Yes, yeah, it certainly is. And one of the things you notice about when they're running the small print and they're reading all the side effects is they're playing music in the background. You're seeing images of people having a good time playing with their children and stuff like that, rather than being in this ICU from the side effects, right? So, it's definitely a good PR campaign. And I don't get me started on the drug companies and how they sell these to physicians. Did you know the state of Washington, in addition to I think about 35 other states, has a list of physicians who receive money from drug corporations, so that you can know before you go in to see the doctor whether they're likely to prescribe you something that they've been paid to prescribe. That's where it's gotten to right now. So,
well, at least we have that list. I mean, I understand that only America and Australia are allowed to do that because it is so completely not in the patient's best interest.
That's exactly right. The only two countries that allow for TV ads to promote drugs. And then they hire really attractive women to go in and sell the drugs to the pharmacists, to the MDs, take them out to lunch and stuff like that. All those wonderful PR. So anti-inflammatory. So neuroprotection. Again, there we go. Did we already do that one?
This one we did.
Right. So I already talked about neuroprotection. So chronic intermittent pain, it's wonderful for chronic pain, and a lot of people require both THC, some combination of THC and CBD. It's usually a small amount of THC combined with CBD that gives you the most benefit. Russo, who's done a lot of research, he's from the University of Washington, and he's also had, so his is an interesting story. He couldn't do the research in the United States, so he created a foundation in the Czech Republic in order to do this research. So he's bringing it back to the United States. So, a one-to-one preparation of THC-CBD is a good place to start if you're having really severe pain, and then you can back it down to have higher doses of CBD and less THC, especially if you can't tolerate the psychoactive effects of the THC. But when you look at the risk-benefit ratio of opiates compared to THC, I think people understood it and could be educated, they might take both the opiates and the CBD THC together, and then they can titrate off of the opiates quicker. That's what I did after I had my knee replacement surgery. So it's called adjunct therapy. You're using it as an adjunct to other therapies, and then gradually pulling out the heavy pharmaceuticals, and then you have the botanical tinctures and topicals that you can buy in dispensaries. Multiple sclerosis, really a challenging disease. Not a lot of stuff that's worked for that. And one of the most promising clinical uses of cannabinoid compounds is the treatment of multiple sclerosis. And now this is one of the pharmaceutical preparations called Sativix that was produced in London, of all places, by a pharmaceutical company in London, where it's illegal, and they're trying to get FDA approval for that. But Sativix is a 1-to-1 tincture, 1-to-1 THC and CBD, and they went through a number of iterations of this, and they found out that they had to create, first of all, create it from a whole plant, not from a chemically derived, a synthetic process made in the lab, and that they had to add a lot of the compounds in that you find in botanical cannabis in order for them to have that synergistic entourage effect that we talked about, for it to have the most benefits. So they're mimicking in this drug the tinctures that you can get and the sprays that you can get in dispensaries. The difference is the supply, a year's supply in the dispensaries costs you $6,000. Sativix costs you in Canada and in Germany, Australia, and some of the other European countries, $60,000 a year.
Wow.
So you can, and when you look at the research, you can see, it looks like the difference is, I mean, people, it would be great if we could have a product that was low cost, that was made consistently by pharmaceutical companies, but we aren't going to get the low cost. We can get products like Sativix that can be used, be helpful to people, but it looks like the only reason you would use this is for profit. And you can go to the dispensary and get a botanical preparation with very similar combination of cannabinoids in it, and spend 1/10 of the cost that you would have for a pharmaceutical preparation.
Is that pharmaceutical preparation like a chemical version of the naturally occurring botanical?
Well, it's an extract from, they extract it from the whole plant. They initially tried to make it from a synthetic chemical, but they found that it didn't work. Mm-hmm. And the only approved synthetic right now in the United States is called Epidiolex. And it's a tincture that it's an isolate, only has CBD in it, doesn't have any of the other cannabinoids in it, no THC, no terpenes, none of the other goodies that produce that synergistic effect. And they have to go up to really high doses, which creates liver toxicity. And they use it for a rare syndrome called Dravet's syndrome, where kids have chronic intractable seizures and aren't responding to other medications. And a little sidebar on that, a lot of parents are getting off of those medications for their kids and going to, you might have heard of Charlotte's Web, that story, Charlotte Figge, who was produced a high CBD strain from some growers in Colorado, and she got on that medication, and she was literally a vegetable. She had something like 300 seizures a day. She was nonverbal. They put her on that for 6 months, and she started to grow and have developmental, access all her developmental skills, and she reduced her seizures to like 3 a week. Wow. So, so again, not everybody's going to have that response, but it should be one of the tools in our botanical and pharmaceutical toolkit, without all the politics and without and having real research done and not hampered by the DEA. it's kind of like, I always think of it as kind of like insurance companies saying you can't use this particular drug because it's too expensive. We'll give you a generic that doesn't work, right?
Yeah.
The generic version, it doesn't work as well. And has more side effects. So cannabis and Alzheimer's. Now, Helen and I have been working on this, the ideas of aging in the brain and preventing dementia for years in a group. We've done a lot of talks in the community about anti-inflammatory diet and how to change your lifestyle so that you can live without fear of dementia, or at least you decrease your risk by at least 60% by lifestyle changes.
Wow.
And the University of Southern Florida, in their Alzheimer's Institute, showed that extremely low doses of THC, less than 1.5 a day, along with the entourage effect of CBD and the other cannabinoids, reduces the production of amyloid beta, and tau protein, which we find in Alzheimer's patients. So again, it has to do with the abundance of an antibody that are attached to CB1 receptors, and they downregulate and they reduce the stress and inflammation. And then the wonderful, so when I was, just a little backstory here, in 1982, I worked at Oregon Health Sciences University Department of Oncology on the oncology unit giving chemotherapy. I had to mix the chemotherapy up in a laminar flow vent, put it in IV. I was giving blood products to people, doing their IV treatment, everything like that. You know, full-blown nursing, floor nursing on an oncology unit. And in that, and right there in the pain medication drawer, the lockbox drawer that had the opiates, the morphine and Vicodin and the Percocet and all that, were marijuana joints, cannabis joints. Because we were part of a study back then that was being conducted in 1982 to see the benefits of inhaled cannabis, a marijuana joint, on nausea and vomiting. Now, back in 1982, and I think it was even in the 60s that it was developed, there was a drug called Marinol, which is synthetic THC, and that they found that helped nausea, but it also made people hallucinate out of their skulls, and so people didn't like to take it. So they were trying this alternative, but they had such strict protocols that they only would give it to people after they were vomiting their brains out or their guts out. And I thought that was kind of stupid. They should probably give it to them before I gave the chemotherapy and see if it would work that way. But that was a protocol. Anyway, it's been established now that it's a very powerful anti-nausea appetite enhancer, because chemotherapy really kills your appetite. So, so that's real. That is a evidence-based use for cannabis. It also, now this is fascinating. In Spain and in Israel and the Czech Republic, they've been doing a lot of cancer studies to look at whether it also reduces cancer tumor proliferation and the size of the cancer. And in the initial studies, it's shown to do that. And in case studies, where people are given 6 months, they said, well, we've given you all of the chemotherapy we can give, go home. You got 6 months to live or 3 months to live. You got a brain tumor or masses in your lungs, or you got this, cancer. One patient had a cancer on the valve between her small intestine and her stomach. And so these people say, well, what the hell? You know, they get on the internet and they look at that and they start taking high doses of THC in oil. And in some cases, it provides them with many, many months and even years of extended life. In other cases, it totally sends the cancer into remission and kills it completely. And then they come back in the doctor's office and they say, well, I don't know how to explain it, but good for you. So, so there's lots of stories about that, what they call case studies or anecdotal studies. But I showed the slide at the beginning of Dady Meyer from the Techion Institute of Israel. He was in Portland last year talking about the studies, and they've identified 9 combinations of THC, CBD, a certain type of cultivar, which means a certain strain, what we call strains of cannabis, with a 1-to-1 THC CBD with certain terpenes, and terpenes are the aromatic glands on the cannabis flower. Think about citrus smell or rose smell or lavender smell. Those are called terpenes. So those are actually physiologically active, and in combination with CBD and THC, they kill tumor cells. And so what Techion is finding is that certain combinations of cultivars paired with certain terpenes kill certain specific tumors.
Wow.
Lung tumors, breast cancer, pancreatic cancer, prostate cancer, something that guys my age are always concerned about. So that is phenomenal research that's coming out.
Is it pancreatic cancer? I mean, that's a death sentence.
That's a death sentence, right? So, I mean, if you can recover from brain tumors and pancreatic cancer, prostate cancer is a death sentence, but it's a 10-year course. But often you have to take fairly uncomfortable medications to get there. So all of that is just wonderful, exciting stuff that's coming out of all the research, and it'll be great when we finally are able to get cannabis removed from Schedule 1 down to Schedule 4 and 5, and to do the research in the United States. But as Sanjay Gupta says, clearly it has medical benefits, and we need to research it. So it used to be, you think about a joint or a water pipe for smoking cannabis. But now we have all these different, these are all botanical routes of administration that you find in a dispensary. Tinctures right here, and sprays. So the Sativex this is a sublingual spray that's similar to Sativex that you can get in a 1-to-1 spray in a dispensary. You can get a tincture in dispensaries, or you can get a CBD with low amount of THC, 0.03% THC, from any hemp producing CBD, or a CBD produced from hemp in Washington and Oregon and California. They all allow, and that can even be shipped across state lines in our state, into our state. And daily doses of that, as Dr. Wink was saying, is neuroprotective.
Wow.
So, and will reduce inflammation. So people should be on daily doses of that, especially during the pandemic, to reduce their stress levels. It also helps with anxiety to some degree. And you can take, just minimal doses, but regularly every day. And it's neuroprotective and anti-inflammatory. Transdermal patches. There's all these medications that are administered transdermally in a patch that lasts for 12 to 24 hours. So this is a way to get that in slow release. You can also have it in a suppository, and transdermal and suppository, it bypasses the processing of the liver, so you can have higher doses of THC, which gets the medical benefits of it without the disorienting effects that some people would get from this from the psychoactive high doses of THC that might be too psychoactive from them. When I was talking about the cannabis oil that people take, this is what it looks like. It's highly concentrated, where you go in and you might see, in a dispensary, you might see THC levels and CBD levels somewhere around 10% or 20%. The full extract cannabis oil is extracted and highly concentrated, and you only need half a grain of rice, and you get 60 milligrams THC and CBD in that.
Wow.
So that's for people. That's like for Crohn's disease, or for some really debilitating condition, or a lot of cancer patients use that when they're giving a terminal diagnosis. And as we talked about, some have extend their life and or have miraculous recoveries.
Well, David, are all these things kind of widely available? And if like if
Every
somebody,
dispensary has them, yeah.
all of them, okay. And if somebody wants to work with like a professional, like a naturopath or something, but like for example, with the tincture, if you're doing the you said go low and go slow. So if you're doing something like that with the tincture, is that something that someone could just like go to a dispensary and give it a try?
Yep, yep. And then also, if you're so some naturopaths can talk when they give you an if you don't need a medical authorization to go into a dispensary. You can buy any of these things at a dispensary if you're over 21. Just bring your ID. But a lot of people, unless you're going into a medical dispensary, not every person behind the counter, the salesperson, has an understanding of how to talk with medical patients. Now, so in Washington and in other states, they have personnel that are medically trained in a state program, but they can't give you guidance. What they'll say is, they'll say, well, other people who've come in with your concerns about pain or anxiety or insomnia have been taking this preparation. So they can't make recommendations. There is one cannabis pharmacist available online that I know, and we have her up on our Cannabis Patients Pacific Northwest website. You can consult with her, and she does a sliding fee scale. She has a master's degree in pharmacology, and she's now taking from the University of Maryland another master's in cannabis pharmacology. So there are, that's the other thing I wanted to mention. Now, the colleges and graduate schools are offering degrees in this because they know it's the new frontier in medicine and botanical medicine. So that's really good news and very helpful. And also on our Cannabis Patients website, we have a list of local naturopaths that will give you a medical cannabis authorization if you feel like you need that in order to get the 10% discount. But to get a 10% discount and you have to pay $150 to get the medical cannabis authorization doesn't make much sense, really. I mean, so.
Not when you can just go in and try the tincture and not worry about side effects. Do you have a slide that shows your website again too, David, for people?
I don't on this slide, but I can do this. I'll stop the share. Okay. And then I will go to Cannabis Patients.
Interesting to me that it's getting some mileage in the medical world, but it is still considered a Schedule 1 or Schedule 5. I'm sorry. What's the bad one?
Schedule 1.
Schedule 1. So here we are getting some understanding about its efficacy on a medical botanical level, and yet it's still being treated this way politically.
Right, and then the absolute obscenity of continuing to arrest people for small amounts of cannabis and putting them in prison and having mandatory minimum sentences as a Schedule 1, like, you know, a lot of the southern states are still doing this. And I mentioned in the last session in Colorado, it took them 6 years and a similar amount of time in Washington here to reverse and to expunge all of the cannabis possession criminal actions against people, expunge their criminal history. So here is, can you see the website? Okay.
Yeah, I can see that.
So here's the, this is, our focus is education, advocacy, and normalization. We're applying for a nonprofit here in Washington. And this came out, again, this came out of a request from students in the 3 years of classes I've been teaching at Clark College about having a regular, to be able to refer them other people to a site where they can get real science information and find out what conditions it works for and how to get medical authorizations, et cetera, et cetera. So we have a section here on education, and that we're continually updating. So routes of administration, we talked about that. Dosing for cancer treatment, traumatic brain injury, palliative cancer care, autism spectrum, and neuroprotection. And we're adding more as we speak right now. And then patient resources. You can go recommended cannabis family physicians. And there you see, and here is Victoria Starr, the cannabis pharmacologist. You can contact her at her website. And here are naturopathic physicians that work with cannabis patients, or include that in their treatment protocols. Dr. Jessica Campbell, for example, is a board certified naturopathic physician that deals with cancer patients. And she does a whole naturopathic approach, anti-inflammatory approach, and she also includes, if it's valuable, recommendations for certain cannabis tinctures and treatments. So that's available. And then you have the process for in Washington and Oregon on how to get authorization.
So people.
Yeah, in addition, you can buy a shirt like I've got on right now, Cannabis Patient Pacific Northwest. So
this certainly makes the Couve cool.
Yeah, it's a cool thing to have in the cool. I've wanted to do this for a long time. And I have to thank Helen publicly for this, because it was her efforts in forming the nonprofit cannabis complementary medicine practitioners of the Pacific Northwest, which I became a speaker, and we did a lot of talks in the community, including at the library where you work, Derya, and supported us bringing in information about how to take control of your health, and what's the newest information on anti-inflammatory diet, and how to reduce your chances of getting or reverse chronic diseases like Alzheimer's and fibromyalgia and autoimmune diseases. And cannabis is a reasonable thing to consider. It's not a panacea, but it's a reasonable thing to consider. And in low doses, regular doses, taken regularly, especially in the tincture form, and a good quality product, full spectrum product, it's neuroprotective.
It's amazing.
Brain cells popping. It's wonderful.
Pretty close to panacea, if you ask me.
Yeah, pretty close. Pretty close to a panacea. It's and as we documented in the first, it's been around series. It's been around forever, tested with people. It was hemp was mandated. It was legal. It was mandated. You had to grow it in the United States, right? In the early United States, and then it was part of the pharmacopoeia, all the tinctures. It was only with the hysteria, and then when you look in the context of what created all the hysteria and the misinformation, and how that then becomes connected to all of these draconian drug laws that have wasted billions of dollars and totally ruined people's lives and ability to get education. It is so harmful. It's so harmful, especially when we can see that having cannabis as an option produces harm reduction from the use of other substances. Yeah. So that's the whole picture, is when you look at the risk benefit, which is the least harmful.
Mm-hmm. Well, it's follow the money again, right?
Exactly, follow the money. And it also is connected to the conversation we're going to have in the future about systemic racism and how that permeates all of this drug war nonsense. And who's making money off of it. I belong to and connected to an organization that's used to be called Law Enforcement Against Prohibition. It's now has a different, it's called Right on Crime or something like that. But it's talking about redoing all of the drug laws and bringing justice into the law and to our legal system. And these are retired judges, marshals, police department, heads of police department, DEA. They just said, this is all nonsense. We've got to do something about it. And I'd love to interview one of them. We've got the speakers bureau for them in Washington. We ought to get them on the show and interview them about that.
That would be great. And that could be where some of that money goes when we're talking about defunding, so they don't have things like tanks and submachine guns.
Reprioritizing, right? From a person who's have a mental health background and worked with these initiatives, these system-wide initiatives, it was really clear. And many of the people high up in Washington Supreme Court, we've talked with them over the years, they all know that early intervention is the way to go. And it costs so much money. It's like $45,000 a year to incarcerate someone. And think about all that going into prevention, wellness, and rather than drug interdiction, So it's a pleasure to be able to talk about this, and it's wonderful to be able to do this to a larger community outside of the Clark College class. Thank you for supporting this.
Thank you so much. This was amazing. Yeah. I feel like we could have gone off, right, Helen, into any area and gone into another amazing rabbit hole.
Yeah. Thank you.
Yeah, and come out with good information on the other side, right?
Yeah. That's for sure. You actually get something. You're not just wasting your time on social media.
Right, yeah. I've stopped, yeah. Don't get me started on that. Well, that's another topic of social media.
Okay.